I'm Michael Betel, president and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Dr. Jonathan Stine is a hepatologist and associate professor of medicine and public health sciences research director at Penn State Health Liver Center. Dr. Stine's an internationally recognized liver expert with a research and clinical focus on metabolic dysfunction-associated liver disease and exercise. He has authored more than 100 peer-reviewed papers, including multinational consensus guidelines and several book chapters. One of his very recent papers, published in Liver International, is entitled Exercise Training Improves Serum Biomarkers of Liver Fibroinflammation in Patients with Metabolic Dysfunction-Associated Steatohepatitis. Exercise, and that's a mouthful, exercise is a huge part of lifestyle management, and I am really looking forward to hearing more. Dr. Stine, you've had a real interest in exercise and liver health, so you know that weight loss is so hard for most of us to achieve and to maintain if you do achieve it, even with the recommended 150 minutes per week. In this paper, you shared some incredibly relevant findings for both patients and clinicians. Why did you do this post hoc analysis, and why is it so important to patients and physicians, and to talk about MASLD?
Yeah, so Mike, first and foremost, thanks so much for having me today, and it's always a pleasure to see you and spend time together, and really just get the word out there about leading a healthy lifestyle, and in particular, how exercise training is beneficial for the millions of individuals who have steatotic liver disease. So, our research group has spent the better part of the last 6+ years really trying to move the needle on the lifestyle research and provide more evidence that exercise training is beneficial, right? We all know that it's good, and as you brought up, many of our patients struggle with achieving exercise or getting to the weight loss their clinicians recommend. And we know in many other populations that exercise is a fairly weight neutral intervention. So there are so many benefits if we focus on things beyond just the scale. And when you talk to individuals in clinic one-on-one and move past the research, you take the bench to the bedside. These conversations are really what drives some of the work that we do, and we're trying to look more and more at benefits beyond weight loss. So we were very fortunate to have funding here at Penn State to bring a very nice holistic exercise training program to our patients with MASLD and MASH several years ago, and it was published in Hepatology. And since then, as there's been such a focus on the non-invasive tests and looking at biomarkers of treatment response. So in light of the emerging evidence here, we went back to our primary study and applied some of the new clinically significant definitions of response to our population, and found that exercise training, again, without any clinically significant weight loss, improved these markers of response, which would then expect to equate to improved long-term outcomes through reversal of liver fibrosis.
And there was a big difference in the AST between the two groups, right?
The ALT predominantly, we did
ALT.
see a reduction in AST, but we do know that if you reduce ALT by 17 international units per liter or greater, that this is a biomarker for improvement in liver fibrosis. And we saw this more often with exercise training, again without weight loss. And another biomarker of response we've done a little work in, along with Rohit Lumba at UCSD, is looking at improvement in MRI measured liver fat with MRI PDFF. And we know that if you get to at least a 30% response or greater with liver fat reduction, that also is going to surrogate and approximate histologic improvement. So we also saw that in this study.
Okay, so this paper was like a confirmation that through the non-invasive tests, you can confirm that exercise does make a difference, even if it's not a whole body weight loss, but for the liver itself and the liver health, right?
Yeah, absolutely. The average amount of weight lost in the study was roughly 3% through exercise training, and it was a 20-week program. And even during the program, there was still dietary counseling. They met with a registered dietitian actually once a week So we were fairly surprised we didn't see more, weight loss from our participants, but it actually allowed us to inadvertently isolate the effect of exercise training, which is fabulous because we can then take this to the clinic and really, help folks, feel empowered, to move beyond the scale as they focus on benefits of leading a healthy lifestyle.
So I like a lot of questions come to mind. I mean, the first point is
Mhm.
3%. In a way, it's not surprising because we hear all the time how hard it is to lose weight, as I said in the
Mhm.
intro. But then when you actually see it in a study, usually in a study, it seems like people perform more because they're getting that, that extra support. They know they're in the study, so they probably try a
Mhm.
little harder, maybe. But it's interesting. Yours was very consistent with probably what reality is.
Yeah, it was a very structured environment, and I think we were expecting more weight loss. As you pointed
Yeah,
out, there's a selection bias in trials where people that are really really motivated to sign up. I mean, folks came and they exercised with us 5 days a week for 30 minutes, plus there was a warm up and a cool down period, and it was in person. At the on campus fitness facility here at Penn State with one-on-one sessions with our staff exercise physiologists. So this was about as big of a
yeah,
commitment as you could expect, which would further reinforce that selection bias. So, we were somewhat surprised by those results, but again, scientifically, it allowed us to, really, move the needle forward here on the conversation beyond just weight
sure.
loss.
And I mean, one of the things we want to do is to be able to share takeaway key messages here
Mhm.
too. I could just ask you an open-ended question, but I'm gonna push it by saying it this way. I do think that you have a really important message here that you can share with clinicians to for their patients that stop standing on the scale. And if I'm wrong, tell me, but stop standing on the scale every day and being disappointed in yourself that you may or may not, I mean, according to the data, it was 3% roughly, that you may or may not have lost weight. It doesn't matter because there's now really two papers at least that you've been involved with that have proven that it does show a benefit to the liver and your liver health. Is that
Yeah, no, I couldn't agree more. I mean, you're it's almost like you're speaking from my mouth with the words that are coming out. I think it's we have a paper out, earlier, I guess in 2023 now in the American Journal of Gastroenterology, where we did a systematic review and meta-analysis of exercise training studies. And this, encapsulated the whole body of research you were talking about in over 1,000 patients. And we saw that independent of significant weight loss, which we define as 5% or greater, that patients who performed exercise training, so 150 minutes per week of moderate intensity activity, such as walking. So, to put that in words, for patients, if you're watching, that's 30 minutes of walking a day, 5 days a week. Which is what the Department of Health and Human Services recommends. But if you're able to complete that, which is challenging, you do reduce liver fat to clinically significant thresholds of response, 3.5-fold greater. So if we go back to what we
great?
talked about with the MRI response of 30% reduction or more, there are many studies when we put them together that show the 3.5 greater odds of improving your liver fat, which would then drive outcomes with fibrosis and likely mortality and the other things we know that are associated with liver fibrosis.
Okay, so do you think, I mean, MRIs and PDFF MRI, they're very hard to get, I guess, for the general public when not part of a study. So the fiber scans, VCTE, you're looking at liver elasticity testing is more common and happening more often, and even serial follow-ups with patients, maybe it's once a year or once every 2, whatever that is. Do you think that this is an important thing to look at too? Is it something that you're going to also add to your body of evidence? Or do you have enough already on this topic?
Yeah, absolutely. I mean, I think, more has been done, certainly from a research standpoint, looking at thresholds of response with MRI-based technology. But as you brought up, it is not widespread in the community, and even at major academic centers, getting access to MR elastography or MRI, PDFF is not always possible. We're very fortunate here at Penn State to have those resources. So we kind of focused on the gold standard with the first study, the NASHFIT study, which is what the paper we're talking about today is doing the secondary analysis of. As we move forward in our NIH funded study called the AMP study, we're actually looking at other biomarkers of response, including ELF and FibroScan, like you brought up. So, we have, as we've gotten more funding and kind of done the gold standard, which has the most evidence to look at histologic response, we're now moving to, how do we take this and be more generalizable? And that involves, markers of response such as FibroScan, which are much more widely available, as you brought up.
I had one more thought, and then I'm going to thank you so much for today.
Yeah.
GLP-1s. So I don't think it
Mhm.
was mentioned in the paper, and I wonder if people were taking GLP-1s and exercising 150 minutes a week and hopefully following a healthy eating lifestyle. How would that change, do you think, the results that you had, if any?
Yeah, so this paper came out, well, the primary paper and the primary research was done, excuse me, before the GLP-1 era, if you will, it kicked off. So we didn't see a lot of confounding from that. If you go to the primary paper, I believe it was only one individual of the 18 in the exercise arm who was on a GLP-1 receptor agonist, and they were on that medication at a stable dose for several years. They were taking that for diabetes, not for weight loss. So I do think, it's an exciting time for our patients. There's so much interest, so much momentum, so many different opportunities. And I think that, exercise training and lifestyle intervention, is a very willing partner, along with some of these emerging, drug therapies, not just for weight loss, but also for steatohepatitis, with resmetirom and things coming down the pipeline. So I think they are partners together. I think, both are definitely going to be more effective. I mean, how can they not be more effective if you lead a healthy lifestyle? You make healthier diet choices. You consume smaller portions. Healthier, fewer processed foods. You're more active on the back end, so you burn more calories. And then we have this great science with drug-based therapy, which augments a lot of those lifestyle changes. So again, I think it's exciting. Both need to work together, and it's not a one-size-fits-all approach, and that's why we run this large multidisciplinary clinical program where we offer medications either on label for diabetes or weight loss, or off label for steatohepatitis, and then we have an exercise physiologist, a dietitian, a behavioral psychologist, and really make sure that we're packaging things so the individual is successful here, at least in our program.
Yeah. Fantastic. Multidisciplinary is definitely the way to go with that tailored care. And you're making a big difference in patients' lives. Thank you for what you're doing. We're going to talk with you again, doing one of these discussions. And when you have a new data to share, it would be really great. And thanks so much for today.
Yeah, this has been a lot of fun.
Thank
Happy to
you.
stop by anytime. Just please reach out, and thanks for getting the word out about exercise. And once we're done here, I've got my running shoes here, and I'm gonna go get a quick 4 miles in before my next Zoom meeting. So thanks so
Way
much,
to go.
Michael.
Very good for you. You're inspiring. Thank you.
Gotta live the life you preach.
Thanks.